welcome back to our YouTube channel, Vegas Family Doulas. I'm Aisha Fanning, owner and doula. We're talking about paced bottle feeding. I'm sure you've heard about it through your lactation professional, your girlfriend's circle, and your pediatrician, your doctors. Well, what exactly is paced bottle feeding and how do I actually implement it? I'm going to show you how today. Take your snuggly little newborn, yes, and they're very, very, very fragile, right? The reason why we pace bottle feed is to help allow the baby to control their feed. There's a lot of talk about nipple confusion, but it's actually nipple preference. And if a baby's going from breast to bottle, it's nice to pace that feed so that they are getting the same feed as if they were at the breast where they're actually controlling the milk. Also, it helps reduce colic and reflux and GERD because the baby is sitting in an upright position. We don't eat our food this way, right? Yeah, so neither does your baby. Their bodies, the digestive system can't handle it. So sitting them upright is step one to getting them to control their feed, okay? What I like to use, you can use your lap. Certainly you can use your lap. But newborns are really small and we get kind of nervous about holding them, right? So we use a nursing pillow. And when you get your nursing pillow, that helps prop up baby closer to you, and then you're not hunching over to feed your baby. You're going to take your bottle of liquid, which you choose to feed, and this is a 2-ounce bottle. When they're newborns, 2 ounces is generally about the size that they can intake without there being any issues digestional-wise. As your baby sit up, support their head, and you're going to insert the nipple into their mouth. You want them to use a nice wide mouth bottle so that the babies open their mouths nice and wide. And once that nipple is into their mouth and they begin sucking, you're going to fill the nipple about halfway, 3/4, okay? And allow them to suck. 5 to 7 sucks, okay? After 5-7 sucks, depending on how your baby sucks, you're going to pull the nipple down. You're going to keep it inside the mouth of the baby, but you're going to allow them to continue to swallow the milk as well as breathe. Now, I know you're thinking, wait a minute, there's air. If they get air, they're going to have colic and fussy and gassy. When we talk and we eat, we're ingesting air. And that's why we burp, and that's why there's flatulence, and that will help move the liquids through safely. Also, there are some bottles that you can use to help with the colic. Okay, so once the baby is done sucking 5 to 7 times, you pull it down, wait 3 to 5 seconds, allow them to breathe and to suck, and then you push it up again, allowing the milk to fill the bottle. Okay, and you're going to do this until you get halfway through the bottle. This is a 2-ounce, so at 1 ounce, I'm going to look at my baby lovingly and pat, burp, nice, good hearty burp them, and then I'm going to switch sides as if they were at the breast and allow them to finish the rest of the bottle. Okay. Once they're done with the bottle, again, give them the nice hearty burp. Even just moving them positions will allow them to burp, okay? And then there you go. You've now fed your baby. It can generally take 20 to 30 minutes, which is as natural as a feed is. So allow yourself that time to actually feed your baby and enjoy it. That's how you successfully pace bottle feed. So I'm going to show you something about their bellies. This 2-ounce bottle is the same as this 2-ounce bottle, okay? Babies' bellies at newborn are only about the size of a marble. And then by day 3, and then by day 10. That's not a lot of milk. So this is plenty. And by paced bottle feeding, you're going to allow your baby to successfully gain and eat and have satiated feeds without worrying too much about their nutritional intake, okay? So I'm going to show you that that's how much your newborn baby's eating. So I know it doesn't seem like a lot in this bottle, but they're actually receiving plenty, okay? Thank you for joining us.